I would like now to invite Tom Judd for the webinar's final presentation. Tom, the floor is yours.
Thanks so much, Calroy. Wow, I get to be the exclamation point on these incredible friends and speakers that came before. Next slide. So what does CED stand on the Alliance? And it is a huge yes and exclamation point. I want to start out just reminding a lot of the group out there today is, been part of many of our webinars or part of our board and collaborators. And we have created a brand, and the brand is not just CED, the brand is wider than that. But you see it's relates to our board and collaborator growth. Today, 420 colleagues from 165 countries, how our congresses have grown. We expect a lot here in a month of you and your friends. Our global CE summits, day, journal, alliance we're talking about, our partnership with WHO, and so on. I mean, our weekday COVID newsletter, which we call Hacking, our training, our monthly webinars. So there's just lots of things that are part of the global CE brand. Next slide, please. And we've done that together. So with this global community of folks, we're so happy about the global network that we have and the impact that we've had. But what's missing? And that's a question many of you have. And going back to that survey that Yadin and others have spoken to, and it was really well done. About a year ago, 700 responses from nearly 90 countries spoke into this, clinical engineers from around the world. So we believe what it has to say is very important. Next slide. And that is, some of these words are familiar to you, but let me slice and dice a little bit. The establishment of a global alliance to clearly identify the field, yes. Promote public awareness, yes. To be able to form liaisons with government agencies, I mean, even business relationships and other healthcare decision makers like ministers of health, that can improve global cooperation and relationships between national societies. And the survey highlighted that CE national societies, and by the way, CED works with over 100 of those, leads to more cooperation. So what am I saying? I'm saying that CED has helped identify the players, has helped identify the best practices, but we found by charter, we're actually limited to optimally partner and move ahead together and actually implement solutions. It's one thing to identify things, it's another to create solutions. So an example of that, just a year ago, many of you know the week that GCEA was born, our colleague Adriana Velasquez from WHO came to us and said, I need global CE community to be a part of a team. And that team is going to look at innovation, all the stuff that's coming in as a result of COVID, particularly through the LMICs. You know, everybody had a ventilator design and oxygen systems and PPE and digital things. And we really needed people that could do a field-based evaluation of that. But CED by itself couldn't have done that. We had the network, but we didn't really have the business relationship with WHO. And we're really limited as we tried to move ahead on that. So, but out of that came a beautiful partnership between CED and GCEA. And many of you know the results of that was Adriana's published innovation compendium just a month ago. Next slide. So this slide is really my next to last, and it's a little bit dizzying in that, you know, what is it that we need to do? You know, we've grown in size, we've created a platform, we have good interaction between one another, but what are all the areas in which we need to implement? And there's several. I mean, the area of capacity building, you know, that could involve education, training, and credentialing. In the area of showing impact to the health leaders, the government leaders, the ministers of health, with evidence-based solutions. And as Yadin mentioned, Dr. Sharma called this morning from India, we need to be able to measure clinical outcomes and demonstrate how medical equipment management, digital health, oxygen, PPE, all that, which now WHO defines as our profession, fits into that. We need to be able to show impact as well as capacity build. We need to be able to collaborate within I already mentioned the 100 CE societies that we're in partnership with, but we need to collaborate without in a variety of ways. One new initiative just approved by the CED board this month is, of course, we want to work with WHO collaborating centers that focus on CEHTM, but we want to work with different centers of excellence around the world that have already got a strong presence in their countries and their regions. And we want to be able to work with them in a business way to receive grants and to deliver research and do all kinds of things. And we really don't have, we have a limited charter within CED to pull that off. So let's get to the punchline there over on the right. With that overarching goal that's been well expressed of improving global health business and clinical outcomes, I'd start with clinical and then business outcomes. The scope of it's really beyond our ability as CED to address, but a partnership with GCEA, all is possible. And with that, last slide. Thank you, and some time for questions.